So it's just really like a lot of little different things that cause the whole big problem.
Yeah, so it's quite a complex condition because they have genetic factors coming into play as well as environmental factors.
Hi everyone, I'm Joie and welcome to Poly Talks, a 3-part podcast series about polycystic ovary syndrome, also known as PCOS. PCOS is a prevalent health issue in Singapore that is often overlooked. We are going to be having medical experts and individuals to share more about their stories and for us women to reflect on our health. On today's first episode, we have Dr. Serene. Hi Dr. Serene, welcome.
Hi Joie, thanks for having me.
I'm so excited to have you on today. Before we begin, can you tell us a bit more about yourself?
Hi, I'm Serene. I'm an OBGYN specialist as well as a fertility doctor. My clinic is SWC, Serene Fertility and Women's Clinic at Gleneagles Medical Center. So I see a lot of patients with PCOS in my practice, so I'm happy to be here to share more about PCOS.
Wait, I'm going to backtrack. So you have your own clinic?
Yes.
That is so cool. Oh my goodness. So I'm sure you see a lot of people going in and out about PCOS. I learned personally about PCOS through friends and TikTok. So I started, on my FYP seeing people like women share their struggles, and we'll dive a bit more into that later. But it was a phenomenon that I had no idea about. I was just wondering, what is this PCOS? Is it just bad cramps? Do I have PCOS?
PCOS stands for polycystic ovarian syndrome, and it's actually the most prevalent hormonal disorder among women of reproductive age. In Singapore, up to about 10% of women do have PCOS. PCOS is characterized by polycystic ovaries on ultrasound scan. It's also associated with higher than normal androgen levels and irregular periods. PCOS is primarily a hormonal disorder.
Oh my God. I'm also learning this right now. This second.
Yes. So actually, PCOS is a hormonal disorder. So the main characteristic of PCOS is actually hormone imbalance.
Right. So you mentioned androgen.
Yeah, that's right.
So that's the male.
Yes. So androgens are actually the male sex hormones. They are found in small amounts in women normally.
I feel like I'm in bio. I didn't take bio, so this is very exciting for me. Okay, so this must explain, because as I mentioned, I was scrolling on TikTok and that's how I found out about PCOS. And I would see women share about having to shave their beards or suddenly growing a mustache. And I just thought that they just have more hair. But it didn't occur to me that it was because of the androgens.
Yes. So what happens in PCOS is that there is an imbalance in the signaling hormones from the brain. And this results in an increase in androgen levels in the body, which affects follicular development. So that's why in patients with PCOS, they don't have regular ovulation.
So do we know what exactly causes PCOS then? Have we found the root cause?
We haven't actually. Yeah, although
it's 2024, guys.
Yes, so there's still a lot of research being done on this, but we do know that it's due to a combination of genetic as well as environmental factors. So a lot of women with PCOS have what we call insulin resistance. Insulin is a hormone that helps the cells in the body process sugar. And what happens is that in women with insulin resistance, they aren't able to use insulin very well. And the body tries to compensate for this by increasing insulin levels. So we think that the increased insulin levels leads to the imbalance in the brain signaling hormones as well as increased production of androgens.
So it's just really a lot of little different things that cause the whole big problem.
Yeah, so it's quite a complex condition because they have genetic factors coming into play as well as environmental factors. And we do know that obesity does cause insulin resistance. It usually can make the symptoms of PCOS worse.
Right, so that's what you mean by environmental.
Yes, that's right. We do also see that quite a number of women do have a family history of PCOS. So if your mom or your sisters or your aunt have PCOS, you might be at risk of having PCOS as well because of the genetic background.
So talking about insulin, my knowledge of insulin is, I would say 5 out of 10 because my great-grandfather has had diabetes. So does this mean that it could lead to diabetes?
Yes, so actually one of the complications of PCOS is actually pre-diabetes as well as diabetes. And in fact, PCOS is a risk factor for developing diabetes at a younger age. About 10% of women with PCOS do go on to develop diabetes before the age of 40.
So what other complications come with PCOS?
So apart from diabetes, PCOS is well known to be associated with fertility problems. And the reason is because PCOS, as you know, affects ovulation. So the egg does not come out, does not get ovulated regularly. So it doesn't meet the sperm so regularly as well.
I've heard this. So I have a friend who they were trying to have a kid. And after like many rounds of trying, they realized that maybe they should go and get it checked, and then she found out she had PCOS. So this makes a lot of sense.
Yes, so in fact, a lot of women get diagnosed with PCOS when they have trouble conceiving and they see a doctor for fertility issues. But that doesn't mean that if you have PCOS, you would definitely be infertile and you won't be able to get pregnant at all, because some women with milder PCOS might still be able to ovulate fairly regularly and still might be able to conceive naturally.
So besides fertility issues and diabetes, are there any other complications that could come with PCOS?
PCOS is associated with a higher chance of getting precancer or cancer of the womb in the long term if untreated. So that means, if you have been found to have PCOS and you get it treated properly, then your chance of getting precancer or cancer of the womb is same as that of a normal healthy person.
So what would you say is the age group that is most susceptible to getting diagnosed with PCOS, for example?
Generally, for patients who are in their 20s to 30s who have irregular periods, should probably get themselves checked to see if this is due to PCOS.
Okay, so I think now is a great time to talk about symptoms since we're on the topic. But before that, we actually have a second guest, a friend called Polly. It is my first time meeting her.
Hi, Polly.
Hi, Polly. So this is Polly. She's our queen. She's smiling through it all. Polly represents the symptoms of PCOS. So as Dr. Serene talks us through the symptoms that we can look out for, I believe we might be able to find them on our queen as well.
All right. So PCOS is commonly associated with irregular periods, oily skin, increased body hair as well as facial hair, as well as loss of hair on the head.
Petal.
So it's also quite commonly associated with obesity, as well as sudden weight gain and trouble losing weight.
So I think what you mentioned were, I wouldn't say normal symptoms, but more subtle and mild. I've heard of novel symptoms like blood clots. Like I heard a story about a girl who passed out a literal blood clot the size of her hand. Is that common?
It's not very common, but I would say it can happen. So although PCOS quite commonly is associated with irregular periods, some patients with PCOS do present with abnormal bleeding. For example, heavy or prolonged bleeding.
Okay, so with how vast the internet is now with a lot of information, I mean, sometimes you get like flu, then you go Quora, and then they tell you actually you have cancer or you need to go to like a hospital immediately. We all end up self-diagnosing, which can actually be quite dangerous. So how would you say, like, let's say I identify that I have majority of the symptoms, what should I do next?
So I think it would be good for you to see like a doctor to get yourself diagnosed with this condition. So the doctor usually would do an ultrasound scan, and usually the doctor would do some blood tests to check your hormone levels.
All right, so before we wrap up this episode, we actually crowdsourced some questions about PCOS on our Instagram. Are you ready to answer them?
Yes, of course. Bring it on.
Right. How do the symptoms of PCOS manifest differently among individuals, and are there lesser known symptoms that people might overlook?
PCOS symptoms can range from mild to severe, but generally obese patients do tend to have more severe symptoms. The reason is because obesity causes insulin resistance, and insulin resistance does promote obesity because the high insulin levels actually promote fat storage and also causes hunger pangs.
Okay, last question, and I believe a lot of us are secretly wanting to ask this as well. Will PCOS go away by itself if I just leave it?
All right. So generally, because PCOS does have a genetic basis, it's probably unlikely to go away, but it is strongly influenced by environmental factors like your weight. So if you do have a genetic predisposition to PCOS, but you manage to keep your weight under control, you may not exhibit any of the symptoms of PCOS or maybe just mild symptoms.
All right. So that's it for the questions for this episode. Thank you so much, Dr. Serene, for your answers. I think I learned a lot today.
Thank you for having me.
For those with questions about PCOS and you would like to have them answered by medical professionals like Dr. Serene or PCOS individuals, please head on to our Instagram and ask away. It is mission.pcosible, mission.pcossible. Thank you so much, Dr. Serene, for your time. Do you have any last words for women facing PCOS symptoms?
So I think although we can't change the genetics, we can control or overcome PCOS by changing the environmental aspect. So one of the ways is actually to keep our weight under control. So that's probably easier said than done. But it has been shown that if you manage to lose about 10 to 15% of the weight, this has been associated with a significant improvement in PCOS symptoms. All right. So I know it's very, very hard to lose weight, but just be aware that there are medical professionals who can help you with your weight loss journey if you need to. And then at the same time, in order to tackle the long-term complications of PCOS, it will be good for you to get regular checkups by a medical specialist just to make sure that while trying to lose weight and improving your PCOS symptoms, the risk of you developing long-term complications is covered.
Thank you so much, Dr. Serene. Just to wrap up what she said, if you are facing symptoms of PCOS, know that you're not alone. There are a lot of people going through this with you, and the best thing you can do for yourself is to take care of your health and work closely with your doctors. If you think that you might have PCOS, hopefully our new friend Polly can help you with identifying your symptoms. Thank you all for listening to our first episode of Polly Talks. Stay tuned for our next episode on consultations for PCOS symptoms. Find out how it works. Does it hurt? We'll see you then. Bye!
Bye!